Hello, my name is Dr. Carolyn T. Long, and I am a therapist, author, minister, and consultant. And I want to talk to you briefly today about dissociative identity disorder, formerly known as multiple personality disorder. Have you ever headed for a destination and got so deep into your thought that you passed your exit? Or have you ever gone through a traffic light and you look back and you wonder, was that light green? And you kind of anxiously wait to see if the car behind you also comes through, because then that would be evidence to you that the light was green. Well, I have certainly had both of those experiences happen to me, as well as many people have had those kinds of experiences. These are normal experiences which are simply brief periods of daydreaming and a loss of awareness, and they are called dissociation. They are mild forms of dissociation. The other types of dissociation is connected with trauma and can be described as a disconnection between a person's thoughts, feelings, memories, actions, and a sense of who she is or who he is. Post-traumatic stress disorder is a trauma-related mental health disorder affecting the lives of 8% of all Americans. And post-traumatic stress disorder is closely related to dissociative identity disorder. In fact, most people who have dissociative disorders also have post-traumatic stress disorders. Tragically, ongoing traumatic conditions such as abuse, community violence, war, or painful medical procedures are not one-time events. For people repeatedly exposed to these kinds of experiences, especially in childhood, dissociation is an extremely effective coping skill. As many as 99% of all who develop dissociative disorders have documented histories of repetitive, overwhelming, and often life-threatening trauma at a sensitive developmental stage in their lives, usually before age 9. A person with DID, or dissociative identity disorder, may also have inherited a biological predisposition to dissociation. But in our culture, for the most part, dissociative disorders are related to extreme physical, emotional, and sexual abuse in childhood. Dissociative disorders, as I mentioned, can be an extremely effective coping skill for the child who is experiencing trauma, but it can be a double-edged sword as well, in that it can be both protective from the awareness of the pain in the short term, but in the long run, a person who dissociates may also find that they have lost their sense of personal history and their sense of personal identity. I often explain to my DID clients the analysis of a circuit breaker. The circuit breaker in our homes are there to protect our homes from fires when there is a surge of electricity. And the circuit breaker does what it says. It breaks the circuit and stops the blowing of a fuse. Well, the same is true with dissociation. It serves as a way to prevent the person from, in quotations, blowing a fuse. So in that sense, it's a very good thing. For persons with DID, dissociation is so frequent in that it results in serious pathology, causing them severe difficulties and preventing them from being able to function many times in their homes, in their communities, and especially when they are under a lot of stress. DID involves an identity in which two or more separate or distinct personalities, or we may also call them identities, take over and control the person's behavior at a given time. Two movies from the past decades that one might think of are the movies Sybil and The Three Faces of Eve. The person with DID may have as few as 2 alters or as many as 100 alters. More commonly, however, 10 alters is more the norm. Alters often are stable over a period of time, continuing to play specific roles in the person's life, many times for many years. Some alters may harbor aggressive tendencies directed toward the individual, but that aggression may also be outer-directed as well. At times, a person with DID at the time that a person with DID seeks professional help, they perhaps may not know that this is what they are experiencing. As a rule, when I suspect that a person may be DID, as a part of my diagnostic workup, I will include an interview with the family members or those persons closest to the individual, as they will be important factors in sharing what they have experienced with this individual outside of the office setting. Because the individual may be unable to remember events in all or part of a period of time. They may repeatedly encounter people who say that, they may encounter people who claim to know them. And I use the word claim to know them because they may not remember that person at all. They may also find items in their closet that they don't remember purchasing. Or if they live alone, they may be baffled by the fact that food in their cupboards, food in their refrigerator has disappeared, and they do not remember eating it. They do not remember cooking it. They may wake up and find cookie wrappers in their bedroom, and they may have no recollection of having brought those cookies to the room or to have eaten them. I may repeat some of what I've already said, but people with dissociative identity disorder may experience some of the following symptoms. They may suffer depression, mood swings, suicidal thoughts or attempts, as well as self-harm or self-injury. They may have sleep disorders. They may have panic disorders and phobias. They may have flashback reactions or a reliving of the trauma, a reliving of the time when they actually split off and dissociated. They may be prone to alcohol or drug abuse. They may have compulsions and rituals, as we see in OCD or obsessive compulsive disorder, and they may also have psychotic-like symptoms. As a matter of fact, 1/3 of all persons diagnosed with DID complain of psychotic-like symptoms such as hallucinations, seeing and hearing things that others don't see or hear. Their eating disorders may cause them to be overweight, and because of their different personalities, may have a very difficult time losing the weight. Because, as I mentioned before, they may eat something that they do not recall that they will have eaten. In addition, they may also experience headaches as they're in the switching mode. So that's the information about DID that I wanted to share with you. It is a serious mental health disorder, but it is treatable. If you suspect that you may have DID, or if you know someone, a loved one that you're concerned about, then I want you to know that help is available. Help is available if that person is you, and help is available to be recommended to that loved one. I want you to know that there is hope, there is help, and there is healing. Thank you for listening.